My name is Dr. Scott Moseman. I've been here at Laureate since 2004. I am the medical director of the program, and I'm still the primary doctor for the adolescent program.
I'm Dr. Katherine Godwin. I'm the medical director of the Adult Eating Disorders program at Laureate, and I've been at Laureate since 2005.
What makes Laureate different is the fact that we are a small to medium-sized, very individualized program where we really pay attention to the individual and how she comes into her program, and make sure that we're treating comorbid conditions, including medical and psychiatric illnesses that they come in with. That's why we have expertise with medical doctors, nurses, dietitians, therapists, all devoted and meeting every day to talk about every single individual patient.
In the adult program at Laureate, we see patients starting even sometimes as young as 17 years old who are, though, graduated from high school and about to enter the college experience, all the way through into even into their 60th decade of life. We've had patients in that age range.
We've always had a philosophy of treating patients to outcome, which means getting them to a place that's a healthy weight range and then having a little bit more time to be sure that their exercise plan and their meal plan it will suit their lifestyle.
Eating disorders really affect multiple things of a person's life, right? So they affect obviously medical issues. So every organ system of the body can be dependent on things changing when they're not eating well. They certainly affect nutritional systems in the body, getting them to eat not only the proper amount of calories, but the correct proportion of nutrients and in a way in which they can convert that and do that at home. They need therapy care. So therapy is still the #1 treatment for eating disorders. So our therapists only ever carry 3 patients apiece. They're seeing those families, they're following those families and those patients in a way to take them where they need to be. And finally, nursing care. Nursing care is 24 hours a day, 7 days a week, where they're taking care of the patient's needs, whether it's at 2 o'clock in the afternoon or 2 o'clock in the morning, that they're there for them and can provide for them so that they're safe in getting the treatment they need. Signs and symptoms of eating disorders can be diverse. I think a mistake that we oftentimes make is always going on weight or other kinds of issues when eating disorders are really stress and anxiety disorders. They can vary from anything from not eating to binging and purging, to being very selective about eating and getting very selective about how they eat. In the end, it's how their avoidance or stress or anxiety gets in the way of their ability to nourish their body, their ability to go to school, to have friends, to go to work, to go to sleep at night, to do the activities of daily living. Once their food and anxiety has gotten in the way of their ability to live a productive life, then maybe it's time to look at treatment.
One of my favorite aspects of working at eating disorders care is watching the patients transition over the course of their care. And family members will very much relate to this because over the course of the illness, they've seen their loved one shift from whoever they were before, from somebody who was vivacious and engaged and an integral member of their family, usually into somebody who's more removed and distant in their eating disorder. And over the course of treatment, often we get to see somebody's personality start to show back up. We get to see their sense of humor return. We get to see their engagement in their families and loved ones, their engagement with staff and with peers start to come back up. And at family weeks and in family sessions, to hear the family members' comments, including that they're seeing their daughter again, or husbands saying that they're seeing their wives again, or children saying that they're seeing their moms again.
I love working at Laureate. It's a smaller program, so it almost feels like we're more of a family. All of the therapists, the nurses, the dietitians, the doctors, we're all really close when we work. We work very closely together. So it's less of a hospital feel, and it's more of just we're here to help you. This is our community tucked away in Oklahoma. So I really, really like the kind of relationship-based aspect that Laureate provides.
I think coming to Tulsa means that you get the type of care that I would want to provide for one of my family members if they were sick. I think we're always trying to get the patient here, treat them like family, and make sure that they get back well. with a family who also understands how to take care of them and how to care for them over time.